Many Canadians, whether you mark Good Friday or Passover, Easter, Tamil New Year, or Vaisakhi, usually this is a time we spend together. You might go to church or to temple or to volunteer. Last year, when I served a community lunch in Hamilton, I saw just how much people come together over these next few days. But right now, this weekend is going to be very different. You'll have to stay home. You'll have to Skype that big family dinner. And the Easter egg hunt, well, it'll have to happen around the house instead of around the neighborhood. I want to take a moment on that to have a word with kids out there. The Easter Bunny has a big job to do this year, and maybe there's something you can do to help. Ask your parents to let you put up a picture in the window to bring some extra chocolate for nurses and doctors. They need a lot of energy to keep us all safe, and this is how you can help them to do their job. Peu importe notre âge, on a tous notre rôle à jouer.
We all have a role to play to fight coronavirus. Earlier this week, I've mentioned that Health Canada launched a call for volunteers to help our frontline workers. And already over 27,000 people have registered to help and give them a little break. Across the country, you're numerous to do your part, and I want to thank you. You're there one for the other, and I know that together we will get through this trial.
These are tough times, but you don't have to go through them alone. If you've lost your job and are having troubles making ends meet, you can apply for the Canada Emergency Response Benefit. Millions of people have already had their claim processed, and they're getting their $2,000 deposit. Remember, you can apply today or this weekend if you haven't done so yet by going to canada.ca or calling 1-800-959-2041. If you own a small business and are struggling to pay the bills or pay your staff, we launched the Canada Emergency Business Account yesterday. You can now get a $40,000 interest-free loan through your bank or credit union. And if you repay it within 2 years, 25%, up to $10,000 of that loan is forgivable. It'll only take a few days for you to receive the full amount in your account. That's money you can use for whatever you need, whether it's monthly expenses or paying employees. On that note, we're getting closer to implementing the wage subsidy, too. We're working with other parties to get this in place as quickly as possible. Tomorrow, we're bringing back the House of Commons to pass the largest economic measures Canada has seen since World War II. It's really important, despite a time of crisis, in fact, because of a time of crisis, that our institutions remain strong and our democratic principles continue. Therefore, this address to Canadians tomorrow will be a little later and from the floor of the House of Commons. And on that note, I'll be taking Sunday and Monday with Sophie and the kids, but I'll be back Tuesday with more updates on how we're helping you. If you just feel overwhelmed, we'll soon have more to say about how you can access resources that can help. If you're in crisis, reach out, lean on each other, and know that we will get through this together. All across the country, there are stories of people stepping up to do their part. To ensure that Canadians are safe and our frontline workers have the support they need, we're helping companies join in the effort. Look no further than Fluid Energy from Alberta. They will produce over 1 million liters of hand sanitizer each month, with shipments starting as early as next week. We've invested in this large-scale production as part of our plan to have enough vital supplies produced right here at home. When Canadians work together, we get things done.
Last night, I discussed once again with the Vice Prime Minister Freeland and the premiers of the provinces and territories. And right off the start of the discussion, we had many people joining the Team Canada. We're all on the same line, all of us, with the premiers of every province, working to ensure your safety. During the long weekend, we will all have to stay home. We cannot have guests for dinner, and we will have to be creative in order to organize an egg hunt inside the house. But it's not because we're physically separated that we cannot be there one for the other. Organizing a family dinner on FaceTime, call your friends, and if you have the means, make a gift to an organization. This long Easter weekend won't be like the others, but I know, however, that it will be filled with joy, with laughter and love. Thank you, everyone.
Thank you, Prime Minister. We'll now open the floor for questions. Go to the phone line. One question, one follow-up. Operator.
Thank you. Merci. First question, Mike Blanchfield, the Canadian Press. Line is open.
Good morning, Prime Minister. Happy Easter, and whatever else is on your plate. G20 energy ministers are meeting today, as you know, and I'm just wondering what Canada's plan is for playing its role with other countries in the G20 after what OPEC did to cut production and to try to boost oil prices. What's Canada going to be doing?
Canada is part of the discussion, obviously, with the G20 energy ministers. Minister O'Regan is sharing our perspective and the challenges that we're going through in Canada, from Newfoundland to Alberta and Saskatchewan. We're going to continue to work because we recognize that this is a global challenge for many, many different countries, and having a concerted approach is extremely important. We noted what the OPEC countries did yesterday, and I know that's going to be a subject of discussion at the G20 energy meetings conversation today. Okay.
We are part of these conversations with the energy ministers of the G20. Yesterday, we noted that what the OPEC country did, and those discussions continue because Canada is strongly affected by this oil production issue.
Prime Minister, so what do you see Canada doing? Do you see it cutting production along with these OPEC countries? If so, what effect would that have in Canada?
As we know, Alberta has already curtailed production and has for some time now. We're going to continue to look to make sure that other countries are doing their part and that people understand that the most important thing through this is to ensure that families and workers across the country and indeed around the world are getting the support they need to get through this crisis safely.
Next question, operator.
Thank you. Merci. Prochaine question, Marie Vastel, Le Devoir. À vous.
Oui, bonjour, M. Trudeau. J'aimerais
Mr. Trudeau, I'd like to come back on this conference call you had with the provinces yesterday. What was the discussion on the use of Emergency Measures Act? We understand it's to spread the equipment to across the country, but you said that the provinces were sharing pretty well, and provinces accepted to collaborate to the hardest hit regions. So should we understand that if you bring this back on the table, it's because the collaboration between provinces starts to be not as good as it was, and you feel the need to intervene? I can underline that the collaboration continues and even is better between the provinces. We see that it's a historical moment where all the premiers from provinces and territories are aligned to work together. Now, the law on emergency, or the Emergency Act, has a pretty formal and robust requirements in terms of consultation, and we're talking about this just in case we need one day to bring it up. So we don't need it now, and we hope that we won't need it. Now, the way our country works is that provinces have emergency measures that they've put in place, and if those measures are not enough in the provinces, then the federal government has emergency measures that we can add to. But for now, it's not necessary, and we hope, all of us, that it won't be necessary. As a follow-up on this Emergency Measure Act, could it allow, in terms of procurement and medical equipment, could this act allow you to centralize the purchase of equipment and increase the Canadian purchasing power, and maybe put the problem a bit not as heavy as it is? The procurement thing is not an issue of power purchase or purchasing power or costs. The costs are augmenting. The difficulty is that different provinces and even hospitals have themselves connections with producers across and manufacturers across the world, and they are using those contacts, those connections, in order to try to get the equipment they need, on top of all the efforts that are made across the country and by provinces. Now, it's not a bad thing that everyone is looking at what can be done, while making sure that we are all coordinating and finding out about what works and how it works. It's an effort of coordination that we are doing right now, and there's a lot of collaboration, and for this, we don't need to go to the Emergency Measure Act. The collaboration is really strong at this point.
Thank you. Merci. Next question, Steve Scheer, Reuters. Line is open.
Hello, Prime Minister. Good morning. There's a story out today saying that the Bank of Canada Governor Paulos was not asked to extend his mandate, and I was wondering, I know there's a selection process in progress and that it's not over, but ultimately it is the government that decides. I'm just wondering if you think it makes sense for the current governor to stay on a bit longer to help underpin confidence during this crisis. Thank you.
This is an extremely important question, because we know the important role that the Bank of Canada has in leading on monetary policy that is an essential part of our handling of this economic crisis related to COVID-19. The government has many fiscal measures, but a strong Bank of Canada is essential in getting us through this as well. And Governor Paulos, as always, has done an extraordinary job and continues to do an extraordinary job. The process is ongoing, and decisions haven't been made as to what the next steps are.
We acknowledge how it's important for the Bank of Canada to have a role, a central role. When it comes to the Canadian response to this economic challenge caused by COVID-19, Governor Paulos is an amazing man who has always been excellent in his job and demonstrates even more excellence during these real challenge. And regarding succession, there's no decision made at this point.
Follow-up, Steve?
Yeah, if I could just follow up, can you give us an idea when that decision might be made?
The discussions and reflections are ongoing.
Thank you. One more question, please, operator.
Thank you. Merci. Prochaine question, Catherine Lévesque, La Presse canadienne. À vous.
Oui, bonjour, Monsieur Trudeau. Juste pour revenir sur la loi.
And just to go back on the Emergency Measure Act, when and what type of case you would need it? There are different scenarios that we've discussed already with the different provinces, whether it's through about the challenges for procurement or restrict even more the movement of Canadians. There are different measures that we could theoretically look at, but those are not measures that are currently necessary, and even in the way that provinces are or can take their decisions and take the measures that they need, the tools that the federal government has currently, such as the Quarantine Act. We hope we won't need to use the Emergency Measure Act, and it would be our preference, actually.
I think there are a number of tools that the Emergencies Act provides for, much stronger controls on distribution of necessary medical supplies and equipment, for example, or further restrictions on travel or on Canadians' freedoms. But as I said, the way our country works is that provinces have Emergencies Act that they can bring in with very strong measures that they have all done. If at one point those measures are insufficient to do the things that are needed to do, and all the tools that the federal government has at its disposal are insufficient to bring forward measures that are deemed necessary, then and only then do we consider the Emergency Measures Act. But as I've said, it is our hope that we don't have to use it ever. We are seeing that the collaboration, the partnership among provinces and territories, and the way we're moving forward on this means that we might not ever have to use the Emergencies Act, and that would be our preference.
Suivi?
Oui. Donc, ça fait presque un mois que votre gouvernement...
It's been a month now, close to a month, that your government has unveiled the first billions of promise to fight COVID-19. But what did your ministers and you have learned in the last month? And are there already lessons to take out of this? What we had to do in the last month was to move extremely fast, to create new methods, new programs to deliver help to many Canadians. Of course, we have our capacity to do all this was tested during the last weeks, but we were able to do a lot so that Canadians this week get help. And we acknowledge as well that every time we moved quickly to help as much as people as possible, as quickly as possible, there are still elements that we need to improve, and we're working on that. And it demonstrates up to what point our public officials are resilient and can deliver in situations that are extremely difficult for Canadians, and it will give us more comfort to go forth and bring measures as necessary that could be new, but we've demonstrated that we can react quickly when the need is there.
I think one of the things we've learned over the past month is that when it needs to, government can move very quickly to help Canadians. We've seen the money from the CERB flow last week into Canadians' bank accounts across the country. That was a monumental task for our public service, for hardworking Canadians across the country who make sure that they are serving Canadians with the best that they have. And I think that lesson that when it's necessary, we can move very, very quickly and nimbly as a government is one that should inform reflections of a government going forward.
Prime Minister, Rachel Haynes here from CTV National News. You've said a number of times that testing is an essential way to flatten the curve, and you spoke to Premier Doug Ford yesterday, who has also pushed for more testing in Ontario. But at the same time, we do know that there still remains a number of shortages when it comes to testing kits. How long will it be until every person who needs a test right now is able to get one?
We are continually ramping up our testing. We started earlier than other countries in terms of intensifying our testing programs. Certain jurisdictions are doing extraordinarily well on testing, like Alberta and British Columbia. Quebec is coming a long way very quickly, and Ontario is addressing some of the challenges that they've faced over the coming days. We know there is more to do, but we can certainly know that the lead that we've taken on testing is part of why we are seeing a flatter curve than other places. We've done significantly more tests in total than the United States has, and they're 10 times the size of us. So we know that Canada's testing regime has been good, but absolutely can get better, and we're going to continue to develop more testing kits, faster testing, because we know that even as we get through this first wave of COVID-19, once we are able to get into those coming months where we will be on guard, but not as shut down or paused as we are right now, testing rapidly and efficiently of as many people as possible will be a key part of that path forward. Okay. We
have made lots of progress in terms of testing in the last weeks, and we knew right off the start that to to track this virus was essential, and to screen it was essential to restrict the propagation of COVID-19 and stop it. And every day we are improving our screening protocols. BC and Alberta are doing really well in terms of screening. Quebec has improved and came a long way in the last few weeks, and Alberta is addressing issues that they had with their screening protocols and the screening efforts, and we will do more because it will be an essential element of how we will be able to get through the whole year without having the current restrictions in place, but having the capacity to limit other propagation of the virus. Now, we've tested much more than in the United States, although they have 10 times our population. And we know that we need to do more, and we will continue to do so.
And over the past few weeks, you've made a number of announcements about Canadian companies and retooling facilities in order to ramp up domestic production. And you just said in one of your previous answers that the government can move quickly when it needs to. But there are still a number of Canadian companies who say that they can supply this medical equipment, but they're either getting caught in red tape or haven't heard back from provincial or the federal government. So how long will it be until these domestic supplies make it to the front lines and into hospitals?
We've had thousands and thousands of Canadian companies step up and offer to be part of supply chains for essential services, for essential equipment and medications. We are working with all of them as quickly as possible. There have had to be choices as to who we could move quickest with, who was furthest along, but we will continue to work with all companies who put up their hands to be helpful, to figure out ways they can best help. This is something in which all Canadians can pull together and are pulling together, and we will continue to do that.
Hi, Prime Minister. Crystal Oak with Global News. Is the federal government considering any measures, such as regulation or federal oversight, to ensure long-term care facilities are protected from this or future pandemics?
There have been a number of reflections and discussions on this. We've seen that British Columbia has taken strong steps to ensure the safety of long-term care workers and residents. Obviously, this is a point of vulnerability, as we've seen throughout the country in terms of the impact of COVID-19. We're continuing to work with health professionals and medical experts to make sure we're doing everything we can to protect our seniors. Okay.
We recognize that elderly's home care centers and the long-term care centers are vulnerable areas for the propagation of COVID-19, particularly for our elderlies and those working with them. That's why we are currently looking at different proposals, including BC proposals to make sure that our elders stay as protected as possible during these tough times.
An increasing number of healthcare workers are contracting the virus. Is that a concern for the federal government, and what is being done to help protect them?
Of course, we are tremendously worried whenever a healthcare professional contracts the virus. That is why providing adequate and significant amounts of personal protective equipment, making sure that protocols are being followed, helping provinces adjust their medical systems in ways that protect our healthcare workers is absolutely essential. We need our healthcare workers not just to stay healthy for their own benefits or the benefits of their families, but we need them to be able to stay healthy for the benefit of our entire community. But we also need them to know that we have their back as they don their protective gear, as they go into battle against this virus for the rest of us. We need to make sure they're getting all the support they need, because they are the ones that are going to save Canadians. Okay.
We recognize how it's essential to give all the support, all the help, and all the necessary equipment to our healthcare workers, and that's why we're working so hard to have the equipment they need to coordinate our approaches with the provinces and work with the provinces and territories in the ways that they want to protect their workers and their healthcare workers. We recognize that they need to be protected not only for them and their their families in order to protect us in a better way, but they need to know that we're there for them. They will fight against COVID-19. They are the most at risk to keep us safe, and we need to be there for them. We need to acknowledge what they do and make sure that they can continue to do the job, this amazing job that they are doing for us.
Good morning, Prime Minister. Salima Shivji, CBC News. A briefing note prepared for your Minister of Health on March 10th actually said that the risk of the spread of the virus within Canada remains low at this time. How do you explain the misinterpretation of the threat of the pandemic at such a late stage?
I think we saw that within days we'd begun to take very serious measures to restrict travel, to encourage social distancing. We moved very quickly and earlier than some countries on countering the potential spread of the virus. At those days, the numbers of Canadians infected were still low, but we saw the potential that we are in right now, and we started to act early. And that's why the measures that we're taking right now, the significant measures that we're in right now, are keeping us, we are hopeful, on the best possible curve to get through this in the coming months. Okay. Nous avons reconnu que ça commençait
we acknowledged that it was grave and it was aggravating, and the impact and the potential for impact was growing across the country. That's why we've acted swiftly to limit people from coming and going, having people to commit to social distancing, and we took some important measures that made sure that the impact in Canada was lower and smaller than other countries that we can compare ourselves to, and we will continue to take the necessary measures so that we have as little impact and the shortest impact compared to these or in these times of extreme distancing.
So was that advice that there was a low risk of the spread of this flawed, and what impact did that have on your government's work to contain the virus?
Our work continued every step of the way, informed by the recommendations made by our health officials. We wanted to both make sure that there were no panics on Canadians, while at the same time getting people to take more and more significant measures, because we knew that the behavior of Canadians was the strongest way of doing what we've been able to do so far, which is slow the spread of the virus, delay it beyond where it's been in other countries, and give us the best possible chance of getting through it. As we look back, of course, there's going to be things we said, oh, we might have said this differently or that differently. There's going to be an awful lot of learning through this. But it remains that as we get through this now, as we live through the measures that we've put in place and lean on each other and hold together, we have the best chance of getting through this in the coming weeks and months by remaining true to the advice that experts are giving us, to stay home, to keep 2 meters apart, to wash our hands regularly, to not go outside unless we absolutely have to hunker down, lean on each other virtually and metaphorically, and be able to support each other through this time.
We recognize that there are always ways to say, well, we should have done this or should have said this in different times. The reality is that we took quick measures to make sure that the progression of this virus was smaller in Canada and in other countries, that we're still on track to lead us to get out of this virus quicker than other countries. We must stay on track, stay at home, keep our distance, not go outside if we don't need it, wash our hands frequently. Those are measures that will make sure that we get through this in the best way possible and rebound economically and as a society as quickly as possible. Regarding the economic rebound, as you're saying, François Legault said that some sectors of the economy that will be able to get back to normal, in action. And you said, well, it'll take a year and a half before we get back to normal. In a federal sense, across the country, there's some sectors of the economy, or activity sectors, that will be able to get back to work soon, and if so, when? We cannot speak about the return to normal until until there's no vaccination against COVID-19. But there are lots of flexibility that we can have once we will get through this first wave in which we're currently in. Now, in our models, we see that this flexibility could start this summer, but even in the fall, we will have to still have among us some measures to keep us safe, to minimize the risk of a surge of COVID-19. And this means that we will not get back to normal of what we had before COVID-19 until we have a virus. We have a vaccination against that virus. But effectively, there are some sectors of the economy, but there's some sectors of the economic activity we can get back to once we're through this first wave, and we're currently discussing with the provinces, with the different industries, with the health experts and our experts, our scientists, in order to determine what would be the best places to be flexible and how we will get out of this gradually. And on that point, I completely agree with Mr. Legault that we should be able to do it in the weeks or months coming, but we need also to think very attentively and in coordination on how we will do this. It could be discouraging to hear you yesterday. It will take a year and a half before we have a vaccine against the virus for this to get back to normal. But could you be a bit more concrete for people? When you speak about sectors that could get back, what type of sector are you talking about? When you talk about measures that will be for a year and a half, what do you talk about concretely? Just so that people can know this weekend to understand what to expect for the next few months. We are in the first phase of the virus now. We are in the propagation across our society, focused in certain areas, but we're all vulnerable to COVID-19 at this point. So we're taking measures to stay at home, not go to work if we can avoid it, not get out if we don't absolutely need it. People know very well, and the situation we're currently in, that we are putting a pause on our economy, a pause in our normal life as Canadians, and we will have to continue to do this until we get through this first wave of COVID-19, which should be the worst. Once we get through this first wave, we will be in a time and a place where we can be more flexible according to some rules. Some people will be able to get to work. Schools could start to get back. Economic activity could return, but it will be made in a way to maximize our precautions and minimize the risk of other propagation of COVID-19. At this time, we will have developed better protocols on screening, for instance. We will have technical and technological capacity to follow up contacts of those who were infected. And we will, at this time, be much better in limiting other peaks in terms of the propagation of COVID-19. It won't be normal as we knew it, but it will be. We will be able to do many things that we cannot do right now and that we'd like to do. But there will be vigilance. Continual vigilance until we get to a vaccine that will be distributed to everyone. And we don't know. Honestly, it could take 6 months, it could take a year and a half. We don't know how long it will take. But our research team are working on this as hard as possible. What we know is that our capacity to ensure that this first wave ends this summer depends entirely on us. Citizens, people who continue to stay at home, that continue to keep their distances, that continue to do what we're doing right now for many more weeks. And at this point, we could speak about flexing or having more flexibility to the rules. for the summertime.
What we are in right now is the first phase of the spread of the virus. This is the phase that runs to a certain extent unchecked or difficultly checked through our society, through our communities. We're seeing new cases pop up here and there. We're seeing people struggle to handle it and to keep these measures from overwhelming our healthcare system. If we do things right, this will be the first and worst phase that we go through as a country in terms of COVID-19. If we keep these measures, these strong measures in place of staying home, of not going outside unless we absolutely have to, on keeping 2 meters apart, in being strong about social distancing, these are the things that will ensure that we will get through this first wave of the virus as quickly as possible with minimal loss of life as well. This is what we're looking for, of not overwhelming our healthcare system. And that happens if we stay strong about remaining at home for the coming weeks. According to the models we've put forward, it is possible that we will be able to be out of that wave this summer. And at that point, we will be able to talk about loosening up some of the rules that are in place, looking at particular sectors where people can go back to work, bringing in new rules around how people can interact with each other in society and get things rolling again. We'll have to be very careful about how we do that, and we will have to remain vigilant and active every single day for possible resurgences of the virus. At that point, however, we will have developed much better testing protocols because every single day we're improving them. We will develop new technologies for contact tracing, and we will all become much, much better at reacting when a possible resurgence happens. So as we look at possible resurgences over the coming months, we will be better adjusted and adapted as a society to minimize them and therefore minimize the disruption to everyday life, to our economic activity. That is the ideal scenario. But it only happens if we continue to stay strong for the coming weeks and stay, inside, keep those 2 meters apart, and be very, very careful about not allowing COVID-19 to spread further. That phase of vigilance, of easing off to a certain extent, but still being careful, will continue until such a time as we have a vaccine for the virus. Researchers across Canada and around the world are working hard on this. It could take as little as 6 months. More likely, it'll take a year or a year and a half, maybe even longer. But I know the best minds are working on that. So we will, once we're through this first phase, be able to get back to something that is more normal, but we will not get back to the normal that we had before, at least until we have developed a vaccine for the virus. That is the reality, but the fundamental bottom line that people can reflect on this weekend is if we stay strong in our social distancing measures now and for the coming weeks, we can see how things can start getting back to normal in the coming months. And we will be able to get through this because that's what Canadians do. We lean on each other, we support each other, and we figure out how to get through the big challenges that life throws at us. Merci beaucoup tout le monde. Have a wonderful Easter.
Okay, so again, the Prime Minister will not be holding these address to the nation Saturday, Sunday, or Monday.